I'm Luisa Mestroni from the University of Colorado, where I'm professor of medicine and cardiology and director of the molecular genetics program at the Cardiovascular Institute. I'm here at the International Academy of Cardiology 18th World Congress of Heart Disease in Vancouver, Canada. I just made my presentation. I had the pleasure to talk today about personalized medicine in dilated cardiomyopathy. It was very interesting to discuss about this topic because many major advances have been made in the last couple of years, both in terms of understanding the impact of genetics in dilated cardiomyopathy and heart failure, and also because of the novel, very powerful technologies we have now available, both in the research but also in the clinical practice. So what I discuss is actually what we know more in terms of gene causing the disease, and then what the novel technique like next generation sequencing can take both to the bench and to the bedside. I concluded my presentation by reminding a number of important points that should guide both research and clinical practice in personalized medicine, particularly in the treatment and management of dilated cardiomyopathy. So how the new knowledge can affect, for instance, the management of patients, the application of defibrillator much earlier than we do with other patients with heart failure. The fact that knowing the genetic condition of a family member can either eliminate the need of a constant checkup, or can allow the starting a preventive therapy or changing the habit in terms of sport activity, and so on. We also discussed the fact that novel knowledges are encouraging in terms of starting therapies for this patient, something that has been not even hoped until a couple of years ago, and how patients are actually asking now in the clinical setting questions that we must be prepared to answer. And finally, how to have a good team of genetic counselor and a team of experts in the field can be really helpful, because sometimes it's very hard in the clinical practice when you have to face also the severe disease of this patient, what could be the complex impact of the genetic background and how to manage that.